Hi, everyone. I'm Catherine Anaya, and welcome to the Women's Eye podcast. This is where you are going to meet fascinating women who are leaving their mark, changing the world, and making a difference. This episode is brought to you by Casco Financial Group in Phoenix, Arizona. Catherine Scrivano is the president of Casco Financial Group. She founded her business to help people create the financial strength that they need for achieving their dreams. Now, I am very, very honored to have as my guest today, Dr. Michelle Tom. Dr. Tom is a Navajo family physician who has been on the front lines of the pandemic on the southern region of her Navajo land, which at one point was #1 in the entire world for cases of COVID-19 per capita. Just think about that for just a moment. We'll talk about the devastating impact that COVID-19 has had on her Dene people, the health inequalities that it has magnified, the toll it has taken on her personally, and what action we can take together to help save lives. Dr. Michelle Tom, welcome to the Women's Eye podcast. I am so very happy to see you and to have the chance to talk to you.
Well, it is a pleasure. Thank you for having me on today.
Well, thank you.
I know your time is,
yes, I know your time is so valuable. So I appreciate you sharing that with us because as I've said before, you are there on the front lines, you are risking your life to save lives, and you are in a situation that I don't think people really stop to consider the devastation and the gravity of it. So I want to begin by talking about just what you've been experiencing working in 2 different overcrowded emergency rooms, often working 36-hour shifts in a situation unlike anything you've ever experienced, anything you probably expected to experience in this country. How are you holding up?
So I think for the first time we have a slight breather. For a while there, it was pretty drastic, working 12, 14-hour days, sometimes 24-hour to 30-hour shifts was pretty hard on all of us who are working front lines, the nurses, my fellow colleagues, the ER docs, the hospitalists. It was something that hopefully was the worst of it. And I think our numbers are slightly down lower now, which I think we all needed mentally, physically, and spiritually, because we are getting braced for the fall weather. Mm-hmm. And now with numbers starting to climb again, I believe this time around we're more prepared, obviously. I guess we really don't know how to feel until it comes again. Even right. Before it, we felt blindsided. Almost because as a physician, about every disease, its treatment, what's going to work, what's not going to work, interventions we can use. And when COVID hit initially, we really didn't have an idea. At least this time around, we might have some stability mentally, physically, just to try to help our patients as much as we can.
Well, I think we're all just praying that we're not going to be in a situation like we were earlier this year, but in the thick of it, in the worst of it, June of this year, for example, the Navajo Nation had the highest per capita infection rate in the entire country, surpassing even New York and New Jersey. Can you give us a mental picture of what you were experiencing during that time? What was the toughest part of that time for you?
I can say personally for myself was just absolutely fatigue, a sense of everything, like I said, from before, a spiritual fatigue that I've never felt before, a mental fatigue and a physical fatigue. We're working so many long hours, really carrying a weight of not only your patients, your community that I come from, but also even worry about your own family. Because usually when I can go to work, I only worry about that and I don't have to worry about my family. But now that I am now with COVID-19 patients in the ER room, on the hospital floor, in clinic, in urgent care, that I was possibly going to pose risks to them. And so it came from all sides. And then they made it into more political issue, which made it even very hard for all healthcare workers who are treating and seeing these patients suffer and get sick. So that was that outside noise as well. So it's nothing you can ever be prepared for as a physician, being hit from every single angle. And then personally getting text messages or messages, so-and-so is sick now, I'm so scared, what do I do? So-and-so is intubated, what's next? So-and-so has died, because I grew up in my community, where I went to high school, where I now practicing medicine, and everyone I know is in some type of relation with me, being my auntie, my grandma, my second cousin, things like that. I don't know how I got through it. And I think a lot of my colleagues will say, you just kind of just go and your focus is just helping. Try to recover, sleep when you can. And you just got to get up and go again. You really don't really have a choice. You just continue to go and try to pace yourself and catch, your breath sometimes. And I can talk about it now and I can feel that, feeling that I can remember it. And it was a very hard time in my life. And I think I can say personally that I went through some dark times of just trying to stay above water. So
what carried you through those dark times? In other words, sometimes people have mental exercises, or sometimes they just have to go deep within themselves to their very core to find that strength. How did you get through it?
I think a lot of that was just being very spiritual. I grew up from a very traditional aspect of our Navajo way of life, our belief of Hajon, which is balance everywhere, all around us. Balance in the way we think, the way we eat, the way we sleep, our interactions with people, knowing that was the goal, staying there, prayer. My family is very much there making me laugh all the time, not talking about COVID. And I think that's a blessing that I don't have anyone else who's in the healthcare field that's in my immediate family, that when I spoke to them, it was about something else, maybe what my niece did or what my mom was doing, keeping the balance of one extreme and then coming back to the other side and being able to do that. And of course, my colleagues, they're the only ones that could understand that, and we could vent to each other. It was like we're therapy sessions with each other. So, yeah.
Well, we appreciate you and your colleagues so very much. I do want to give people a sense, because you talked about how important family is and how connected you are to everybody there on the Navajo Nation. And I want to talk a little bit to give people some perspective about what this area covers. It's 27,000 square miles of territory across Arizona, Utah, and New Mexico, with a population of about 175,000 people. We're talking about an area, as we've discussed, that is about the size of West Virginia, and yet there are only 25 ICU beds on the entire reservation, only 12 healthcare centers, and only 5 inpatient hospitals on the entire Navajo reservation. Can you give people some context or some perspective about what happens when you are at capacity? What happens when you have to turn patients away? What happens to them? Where do they go? How do they get there?
So that was probably the toughest part about this whole situation, because, I think people take it for granted having an ICU, or you're living in a metropolis. You have all these hospitals, have ICUs and special care. On the reservation, we don't have that luxury. In the city, you could be in the ER for about 2 hours. Within another hour, you're in the ICU bed with specialists. We have cardiology and pulmonology. We've already started antibiotics in the ER. You're already being stabilized and only moving a couple of floors. It literally could be in the ICU. When I was in residency, within the hour. And that's the beauty of living in a city. Being very versed in medicine like that. However, people on the reservation don't have that luxury. You have to first travel, right? We have a lot of dirt roads, paved or not, just to get a facility. And knowing that we don't have 5 inpatient hospitals, sometimes I have patients driving an hour to come see me for a clinic visit. Not even that, if you have an emergency and you call the ambulance, it's 45 minutes there, an hour there, then an hour back, just to be evaluated. And at that point, we get you in the ER, possibly onto the hospital floor, and things are going south very quickly. Our facility does not have ICU beds. Therefore, we have to transfer you down to maybe Flagstaff. It's available, and there's numerous times they were full, numerous times. And then we'd have to get you down to the valley. And that turnaround time has, in the city, you could be in an ICU bed in it within the hour. Now we're looking anywhere, possibly 6 to 10 hours before you get that care. And in a critical situation where you're needing oxygen and you have a tube, and any movement increases your morbidity, mortality of basically life or death. And now you're going to chopper them up into thousands of elevations, going across movement, and then dropping them back down again. It's immensely difficult. And then they're alone, right? You usually have family member. If you're so scared, some people have a hard time just going to the hospital, right? They just can't stand maybe the silver and the lights and the hospital smell. Like they're afraid. They come in literally just afraid when I see them in the ER, when I have to hospitalize them, or if I feel like, we can't take this patient here, but they'd have to go somewhere else.
And they don't have family with them.
They don't have any family, and they're so afraid. They're so afraid, and then they can't breathe. They're like, okay, what can I do now? How can I make myself feel better? And there's like, well, we're doing everything we can. There's nothing else that we can do, but maybe you can try to lay on your stomach a little bit, doc, I really don't want to go anywhere. My family's here. I don't want to leave. And then they're almost at a point begging just to stay.
Oh.
And crying. And they're like, can I have so-and-so in here? I'm like, no, we can't. And then I have to end up flying out, and they don't know anyone there, and they can't be visited by family.
Mm-hmm.
The other thing that really just gets me is if it's a Navajo speaking only elder. And there have been times I've had a 70, 80-year-old couples who are Navajo speaking only, and one will go to the ICU, one will stay.
Oh.
And that is probably the most heartbreaking that I've been a part of.
Mm-hmm.
Is that now they're going to some foreign land, according to them, because they've been on the
reservation. Yes, that's essentially what it is.
Yeah, and they can see people that look like them and to speak Navajo, and it's the only way to converse. And now they're going to Phoenix, so they don't have any family.
Mm-hmm.
Who are they going to converse with? Who is going to look like them to give them some comfort? Because sometimes it's just someone holding your hand.
Absolutely.
And they don't have that anymore. And people don't have, tablets in there or Wi-Fi on the reservation to talk to them or see them. And now majority of all the rooms, you're completely dressed from head to toe, and everyone that's coming into your room, the only thing you can see is their eyes.
Mm-hmm.
And I couldn't imagine. I couldn't imagine that feeling myself. I think that more than anything, that's the hardest for me to try to swallow when I go to work.
Yeah.
Because there's nothing I can do.
I can't even imagine what that must be like, and what a blessing to have you there. When we talk about the families and the communities and how important that is to be together, a lot of people, I think, sometimes wonder how the situation is so severe on the Navajo Nation. And I don't think people are aware of some of the living conditions. A lot of the homes, what is it? Something like 40% of the homes don't have running water. Families live in generational homes. I think I've heard you mention before that, you have a number of family members in one home. How has that influenced the severity of COVID-19 on the reservation?
There was this whole thing. Well, when you look at rural communities, well, they're going to be okay. You know, that's the idea, because COVID-19 is what, social distancing, anything like that. And theoretically, yes. However, you hit on all the marks, right? We have households that have the grandmother, the daughter, the in-law, the nieces and nephews. So we have like minimum like 3 generations. And the thing about that is we're very matrilineal. Our society is very, you know, our origin stories, the community of just helping one another, that it's not about self, it's about your community. And then it's also always about the family. And so we have a really tight kinship, not only with our immediate, but our extended family as well. And that's who we are as a people in general. So we have multiple multi-generational homes. You know, they're grouped together. They'll have like 3 or 4 homes in the same area, right? The grandmother, the daughter. Even my home is like that. And that's what we've always known it to be. You know, when we have a gathering on a birthday, everyone's going to go. You know, if someone's sick, everyone's going to be there. Everyone's going to chip in, you know, because that we've always been taught that comes first before self. And so you have this spanned out all over the reservation. Then not all of them have running water. So you end up having to designate someone to go get the water, right? So now you're going out there and possibly getting infected and then bring it back. You know, they have to get water, they have to get essentials for groceries, because, you know, we don't have Sam's Club and, you know, Amazon to come deliver, right?
Exactly.
The safety of that again, you're going to have to designate someone to go out. And then if there's no one really working, you're going to have to designate that person to work too. And so we've seen that even with my patients here. It's usually the younger generation that has to work and do these things, and they may catch COVID and then they bring it home, and now the whole family's exposed. And so that's how it's kind of just spread so quick and so rapidly when it hit the reservation here.
Mm-hmm. I think that's really important for people to understand, that you have these inequalities when it comes to infrastructure. We've talked about some of the health inequalities, you know, that people on the reservation are dealing with. And that leads me into my next question about, you know, how you ended up returning to the reservation to practice medicine. I want to talk a little bit about your road to becoming a doctor. You went to Arizona State University, where you were a standout basketball player, recruited by Coach Charlie Turner Thorne, who is a friend of ours here on the Women's Eye. She's been a guest. Great. Yes, we adore her. You graduated with a degree in microbiology, eventually moved to Florida for medical school, earning your medical degree in osteopathic medicine in 2015. You did your residency in Southampton, New York, before returning home to practice family medicine. Was that always your intention to return home to practice?
Yes, I think sometimes people always ask me that, but yeah, absolutely. I grew up on the reservation. I knew about the healthcare system here. I knew how my parents at that time, very early on in government healthcare, I felt they could have been treated with better equality, I should say. Even going to my own appointments, I never saw anyone that looked like me or spoke Navajo. And I felt that there was a huge disconnect. And I wanted to come back and help. Because I knew once that you have a connection with your physician or the nurse, you're more at ease spiritually, right? And I think when you can connect someone, you're able to open up, and then you build a trust so you can get your health better. And I think that was the goal. And if you're not healthy, then you're not happy. You're not happy. If there's some kind of pain, you're not happy. And so I felt, even with our spiritualism and our Navajo belief system, I felt I want to be a healer of some type. I even thought about going to physical therapy for a while. And so I had my mentor say, well, what's 2 more years after that? And she failed to tell me it'd be another gazillion years of residency, but that's okay. But yeah, I always knew I was connection to my people and to the land. If one of our own can't protect it, then we can't depend on anyone else. So it's huge, and it's dear to my heart. It's always been a dream to come home. So I'm extremely happy, and I wouldn't be anywhere else.
Well, and so there you are. You're only there about a year before COVID-19, which, as we talked about, nobody could have expected. And it's placed this enormous strain on medical facilities that have already been strained. You've helped, I follow you on Instagram. You've helped coordinate a medical relief team where you collectively gather inventory and you deliver thousands of donations to healthcare workers, which is so phenomenal. The various facilities, the Native communities on the Navajo and Hopi reservations. I mean, this is critical aid we're talking about. And you're only scratching the surface of the people that you've been able to reach, which is incredible in and of itself. What is it that you need and how can people help you?
If I had unlimited amount of funds, I would build us, multiple facilities with ICU capabilities, and let's hire the specialist cardiologists, because ideally, big picture, our big dream is, when I have an elder who's 80s Navajo speaking, they'll just be within the ICU within 2 hours and get to stay here, right? And have nurses that speak Navajo, a doctor who speaks Navajo, give her some comfort, and still have the state-of-the-art facility to get her healthy. That's the ideal dream, right? However, in the acutely, that's probably decades away. I think the biggest thing is having people, we're in the voting era, right? Or this voting issue is right now. The last day to vote is November 3rd. Voting is now. And just getting the people who are responsible for budget, for Congress, to give our money to, the Indian Health Service, right? Just so we can build those type of facilities and be able to have those types of specialists on the reservation, not just mine on the Navajo, but the Hopi and the Apache, all the First Nations of this country. We're supposed to be, in a sense, first world for everything, the best medicine, the best in this. And yet in your backyard, we're living in third world kind of conditions. And I think that, just to know that we're still here, we're still viable, we're still a very strong minded people. And I think because of the resilience, we're still here. And a lot of people, my peers, my people who probably in my generation and younger are now really getting themselves educated and coming back home. So it's exciting. It's amazing. So
it's really amazing. I mean, you've started a trend.
No, I've had some trailblazers that I've looked up to for such a long time, and mentors who've been just in the gutter working. And I think for the first time, this pandemic has really opened up. We've always been there, but it was like a Pandora's box to say, hey, look at us. We're first time in the history is getting a lot of national attention, but also globally. It's been amazing, and we're getting a lot more recognition and help. And I think it's definitely turned for the better. And unfortunately, I had to take COVID to do that. But I think you always look for blessings in any type of disasters, because that gives hope, and then you build from that. I think you build from that, and I'm looking forward to the future, for sure.
Well, you certainly have been a critical part of that. You've been outspoken. You've been giving a voice to the glaring health inequalities that exist, not just for the Dene, but for all, like you mentioned, tribes in the U.S. and North America. I came across a quote from our friend, Coach Turner Thorne, about you, and I want to read it because I think everybody should hear this. She said, "I have never met anybody so determined to do what they said they were going to do when it was so hard to do it. She is the greatest success story of my life." And of course, she's talking about you. And I read that and I get so emotional because I'm like, wow, to have somebody say that about me. So incredible. Do you believe you're making a difference?
I feel like honestly, I feel like I'm just doing what I'm supposed to be doing. I don't really need any attention. I just feel like my duty is what my family had taught me, what it is to be a Dene. and really trying to be a healer, just because that's been instilled in our origin stories and our belief system and our relationship with Mother Earth and the Creator. This is what we're supposed to be doing anyway. I don't know. Just leaving this place better than I came into it, for sure. Yeah. Oh, that's very generous of Charlie. That's for sure. I think she and her mother had done so much for me and taught me about like life skills at ASU. Right. You know, Charlie was super hard on me. She gave me no slack. You know, I couldn't have ever imagined her saying that about me ever. Just because she is about business. She's like, if you want to do something, just do it. You don't really have any excuses. You just don't. You know, the only person that holds you back is yourself. And I think having that and seeing it and things she's done with our team back then and what she does even now, what she stands for is amazing. You know, you're always giving tools. It just depends on what you do with them and how long you keep going. Because, you know, being a physician and stuff like that, it's pretty hard. It's pretty for a long time. Maybe I'm just naive. Maybe because, you know, I didn't have any, no one went to college before me and, or a master's or a doctorate in my family at all. So I think maybe I was just naive at that point too. I just didn't know any better. I just thought, oh, well, okay, she says I can do it. I guess I'll just try and do it and finish it up. So
it is remarkable when we get older and we reflect on the people in our lives who were the hardest on us. They were the ones who truly believed in us the most. And that's why they were hard on us. But sometimes in that moment, we don't really understand what's happening.
Yeah. Being very young like that, I was just like, you know, you're wanting some pat on the back from the person that you may possibly admire. And they're just giving you the hard road and telling you like, you should be doing this and you should be doing that. And it's like, but yeah, and you realize multiple people played a huge part of my life that gave me an open door. You know, he opened it, but, you know, doing the work was something that their words definitely motivated me continuously. You know, my family, prayer, all of it all came together. I feel like I'm still going through that because this has been a long road, you know, and it's still going on. It's still going on. We've been hitting since March and, you know, we're almost in November here. Right. And we have a little dip in cases and it's starting to climb back up. But,
it's a little scary, isn't it?
Oh, yeah. And the public health professionals and a lot of the statisticians are saying that it's going to be worse. You know, and I believe a lot of science and biostats because I have a master's in public health. So, you know, I follow a lot of different organizations and statisticians, virologists and things like that. So I always knew it was coming when it hit China. I just like when it hit Italy, I was like bracing myself, trying to how to sit down my family and talk to them before it hit. Yeah, it was super scary and knowing too much, I guess. Right. At that time. But now it's better. Yeah.
Yes. But it is such a blessing, like you said, to be there with your family, to be there with your community, to be a face that they recognize and that they trust, and to be there to give them comfort. And I just, you know, my final question for you is what would you like people to know about the resiliency of your tribal nation?
I think that we still are very strong in our origins, in our language, in our culture. And that's what we're really trying to protect. Like, that's why we are about community, because the community part is as long as you're strong as a community, then you're immensely unstoppable, you know? And I think there's such beauty in our song, in our way of life, that it's worth fighting for, you know? And I think diversity in our community, depending on gender or race or social class, diversity is what gives life color. It's so beautiful, and you know, different foods that you have. And I've traveled and I've lived in different parts of the country and traveled the world already. And I think that's why I fight for different languages and cultures and belief systems. Because if everything was the same, it'd just really just be black and white. And not even that, maybe just in black or just all white, you know, with just one thought. but I think that being Navajo and still carrying a lot of this is tremendous, and we're very strong, we're very resilient, and we've made our mark a lot along the history of the Navajo code talkers and things like that. That any help that we get to sustain that would be tremendous, and yeah.
Dr. Tom, I thank you from the bottom of my heart for your time, for being there on the front lines, for saving lives, for risking yours. I know I read that you had to be away from your family for months because of it, and I can't imagine how difficult that was for you. So thank you for being who you are.
Well, I appreciate it. I thank you for giving us visibility and giving us a voice for all the work that you're doing. And so I would not be heard unless it were for people like you. So thank you.
Well, I want to let people know how they can donate to your medical relief efforts. Can they go to unitednatives.org?
Yes, if they go on to the website, you'll see a link there. I believe we take PayPal and such. So a lot of that we do with unitednatives.org is collecting more of the public health things versus other sites where they put food boxes together. Being a physician and my medical group of like 6 or 7, we're all doctors. So we kind of look at the public health aspect of that. So we try to purchase more PPE for frontline workers, but also community PPE, like reusable face masks, getting cloth masks, hand sanitizers. We bought out this huge like Lysol for sprays and wipes, because you can't find that anywhere, because those things do more, right? They actually stop COVID, right? So hand sanitizers, so things like that, they're a lot more expensive because of supply and demand. So a lot of the funding that we get and donate, we buy those things, and we partner with actually other grassroots who actually get out there and do food boxes, and so they can put them in those boxes and it gets out.
Right.
Because they can't find it. And so we've been fortunate. A lot of these organizations can't get those things. And we've used major change, even people from New York. We've bought in so much liquid sanitizer from the actual company that supplied the New York hospitals. Mm-hmm. And I think that just has been amazing. And using the huge Lysol, the company, to purchase that, because you just can't do that. So we've been very, very blessed and very fortunate.
That makes such a big difference. That's incredible.
Yeah. So we've been able to do that and get in those types of products, basically for COVID. Stopping it in its tracks so you don't spread it. So that's our focus.
Well, it is obviously a life-saving focus, and we want people to donate. So again, it's unitednatives.org. We encourage people to continue to help and support you, and just create awareness about what is happening on the reservation. And again, I just thank you so much for your time and your service and everything you are doing to continue to save lives. So thank you. I want to let people know that they can find out more by going to our website, thewomenseye.com. Also, people should know that we have a book. The Women's Eye has a book. It's called 20 Women Changemakers. We'll definitely have to get you in there, Dr. Tom. You can shop for it wherever you buy books and at changemakersbook.com. Thank you, Dr. Michelle Tom, for being my guest today. That's going to do it for this episode of the Women's Eye podcast. I thank you so much for joining me. I'm Catherine Anaya. Until next time, remember, it's the world as we see it.